welcome everybody to Health, Wealth, and
Relationships with Tisa
and Grant.
Good morning, everybody.
And what are we going to talk about today? It's the first show of March.
It's
right?
March. Welcome, March. You know, March has a lot of stuff going on in March. So today we're going to be really building. So our thing today is going to be focusing on building health for generations.
I like that.
Right?
Like that. Yeah.
And but March has a lot going on. March is
Women's Month. Can't beat that.
Women's Month. March is colorectal cancer month.
I didn't know that.
March is nutrition month. So we're going to kind of start with the nutrition month and kind of really talk about the importance of prevention from cradle to the grave, really.
Cradle to grave. We got a special guest, right?
Yeah, we do.
All right.
You want to bring him up?
We're going to bring him up. One of my good friends. I went through high school. He's a little bit, class or two above mine. But the Pattens and the McGaws know each other. We found out he also ran with the Bryans. They were right across the street. Those are my cousins as well. We can connect all these dots. He's talking about boys club. So I didn't go to boys. He said, I lived in the boys club. He shut it down in the boys club. I made my appearances. I would say it like that.
Yep. And I know Mark from Boys Club days. He running with my brother. He's a little bit older, like he said, class of 79. So we're all neighbors and friends from way back when.
Absolutely.
Glad everybody's doing good. Everybody's doing good.
Everybody's doing great. And I was at the Empowerment Network at City of North Omaha just recently. I think it was in February. It could have been January. And one of the last sessions they had was on health. And they said it's going to be presented by Mark Patten. I'm like, racking my brains. I'm like, Mark Patten, my Mark Patten?
Like, not my Mark Patten. Not his Mark Patten. He's stupid. His very own Mark Patten.
Well, but I was so proud of you, man. You're doing great things at the REACH program. We really need to understand this even more about what you're doing around REACH. Because Tisa, she's big in healthcare. Lead us down this road and tell us more about what we're going to talk about today.
Okay, great. Again, thank you for having me here today. I'm it's an honor and a privilege to talk with both of you, and hopefully we can enlighten some minds and bring some knowledge to the people to help them make their lives a lot easier.
Right.
Okay. Right. Now, REACH program. I work with Creighton University in Center for Promoting Health and Health Equity, and the REACH program is actually a 5-year grant from the Centers for Disease Control and Prevention to work with the populations in North and South Omaha, Douglas County, African Americans, and Latino populations on 3 core strategic areas: nutrition, physical activity, breastfeeding support, continuity of care, and there was actually a 4th one that we no longer do, but it was adult vaccinations. So what we do is work with the community in terms of bringing knowledge and information to the community of North and South Omaha about these very important health areas so people can have an increased quality of life and begin to do something to address the health disparities that impact people of color in our community. So that's the Reader's Digest version.
Yeah, that's right. And that's good. So you mentioned 3 main programs. And so when I was hearing about your programs, I thought, I'm always trying to figure out how can we partnership and, really just kind of attack health disparities more out of our bubbles and do more collaborations. And when you said, I'm with the physical activity, I'm with the nutrition, but the breastfeeding really hit me. And I was like, You know what? That just was like lined up with Pink Lotus in terms of, I don't know if many people know the statistic that if you breastfeed, it really brings and reduces your risk of getting breast cancer. Yes. And so those are one of the statistics I really wanted to bring to the community, because there's a lot of things I've learned being a 14-year breast cancer survivor that I didn't know 14 years ago. And it's kind of like what I know now, I want to share people going through it, because it's important. And I think I would have moved differently if I would have had some of this information 14 years ago. So I'm here to share all that I've learned and all that I've gathered up, walking in purpose, because Pink Lotus is my purpose and my passion, but also just to help the next generation, help women coming along. So breastfeeding is kind of prevention. We can look at breastfeeding as prevention from the cradle to the grave, right? So from the beginning, and let's even go back further. We want to go back to the mom, right? So in our whole goal of making a healthier community, let's start with our young moms, right? Giving them information on nutrition, It starts with nutrition, and that's one of you guys' main things. So
Yes.
it all ties into a healthy community, right? So starting with nutrition with the mom, we want to make sure that they have programs not only to get healthy foods. Tell us about some of the things that you guys are doing in terms of your weekend farmers market. Like, who are you collaborating with? Because healthy foods are important to our community. So what is Reach doing in terms of hitting that nutrition piece?
Well, one of the first things I want to connect it back to what you said earlier about moms who are pregnant. And the thing that we want to make sure moms are eating properly, because you need to eat right in order to make that, to have the healthiest baby possible.
Absolutely.
So cutting down on processed food, eating more fruits and vegetables, trying to get some exercise and stay active. All those things play into keeping a mom healthy while she's pregnant. Then when the baby comes, we really want to emphasize that it's really important to breastfeed babies as long as you possibly can.
Yeah.
Because it's healthier for the baby.
And so, Mark, let me step in as a mom, because you guys have never breastfed before. and I want to say it, in our community, breastfeeding is not really encouraged. Nope. I had 2 sons and I didn't breastfeed either one. And just really a lack of knowledge on the importance of breastfeeding. Again, back, my sons are 32 and 34. 30 years ago, they didn't push it, and they definitely didn't push it in our community. So again, it's important that we encourage our African American moms to breastfeed. It was kind of not, it was kind of like you can or you can't. It doesn't matter. But really, it really feeds the baby. It feeds the baby, and it gives the baby a healthy start from the beginning. And so as much as we can encourage it, although it wasn't encouraged 30 years ago, we really need to encourage our women to go ahead and breastfeed, take the opportunity. It ain't easy. Breastfeeding ain't easy. Nope. It ain't just like, switching out a bottle for a boob. It's not that easy. And not all babies will breastfeed. But if you can, I encourage all ladies that are even thinking about having kids, think about also breastfeeding during that whole journey, just to give your baby a healthy start.
Correct. And I think what you said was really important, because mothers were not encouraged, especially African-American mothers were not encouraged to breastfeed.
Nope.
So when you got out the hospital, they would give you all these vouchers and all this formula.
For WIC and formula, right.
Yeah. But they also knew at the same time that wasn't really best for the mom or best for the baby. So what we have done is work with the hospitals and the clinics and the places in the community where now they are breastfeeding friendly. So they encourage moms to breastfeed and stop pushing those formula on the babies unless a baby has to have a formula.
Exactly. Like I said, sometimes it don't work. Yeah, if it has to be.
But we want moms to understand that should be your first thing you should think about. Think about breastfeeding, and the longer you do it, the better it is for the baby. You don't have to do it for 3-4 years, but if you can get that first 6 months in, that's really, really beneficial.
Oh, no, we don't want to breastfeed 3 or 4 years.
No.
And I've seen that. And I'm just going to say that ain't necessary. There's some benefits. And I think when people breastfeed that long, there's benefits because, it does supposedly snatch your waist back. It does kind of let some of those baby fat things tighten up as you breastfeed. So there's benefits to breastfeeding for the mom. But sometimes that got to get, you should be in about 2 on the breastfeed.
Well, let me give you some statistics.
I'm just saying.
These are some stats here that I got, especially from the CDC on breastfeeding, right? Number one, to your point, both your points, it's not just about feeding the baby, because it is a long-term health protector for both the mom and the child. I think that is big, especially when you first are coming out into this world. You want to be exposed to so many diseases and that type of thing that are out there. Now, here's some stats. Black mothers, and this goes back to 2022, 78% have ever breastfed. However, white mothers, 87%. So it's a 10% gap just right there. And then at the 6-month mark, it starts to even reduce. So 54% for Black mothers, 65% for white mothers, 32% for Black mothers at 12 months, and 44% for white mothers. So what is that telling us? They're saying that the research cited about 4.3% lower breast cancer risk for every 12 months of breastfeeding. Those are the statistics.
Yeah. One of the things that we did in our program the first thing we did, we surveyed the community because we wanted to know what the community felt. It wasn't about us imposing what we thought on the community. We wanted to know what the community thinks about these areas. And some of the things we found out is one of the things that that Tisa mentioned, a lot of men don't know anything about breastfeeding.
Yeah.
You know, they have little or no knowledge about breastfeeding or even the benefits of breastfeeding. So one of the things we wanted to be able to do is get brothers and men to start supporting their moms and their women in their life who are breastfeeding, to give them that support, to encourage them to do that, and to have that conversation with the mom, with the B, and say, hey, I think this would be a good idea, and I'm here to support you. Because you know, moms need to be supported in terms of if they do decide to breastfeed. But one of the things we found in our community that a lot of women did not even know that lactation consultants or doulas that even exist in our community.
Right.
And there are organizations out there that they do that full time. Black Girl has a list of doulas. Milford has a list of lactation experts. So there are people in the community that are there to help you get through this and give you the information that you need in order to make a better decision.
And that's important to know, because again, it's one thing to say breastfeed, but it's like, how do you do that? It's a natural thing in a lot of ways, but it's a process. You know, sometimes your body is not ready to dismiss the milk. Sometimes the baby doesn't latch onto the breast. Sometimes the combination is just not working. And so the more you can work with a doula, and a doula is just it's like a birthing mom. It's like a person to help you through the whole pregnancy process. People don't know what doulas are, but they'll help you through the birth. But even prior to the birthing process, help getting you ready, help you understand. Even having a baby, we don't know what happens having a baby till we have the baby. So, you know, so if somebody can walk us even like what to expect, even having a baby is a good thing. So doulas help you through that whole birthing process, before and after, the most natural way. They don't use medications. A lot of people are going back to doulas because, you know, we're dying at birth now. With this Ivy Black Girls' whole mission is legislation around, you know, living through the birthing process, which wasn't a problem back 30 years ago. So again, we got to go back to why are our mothers dying? Why are they not healthy through the process? Are we having stillborn babies? Like where is this mortality rate increasing from? And we need to start intervening.
What you
said.
It
starts with taking care of yourself first.
Go ahead, Mark.
Take care of yourself first. Starts with the mom.
Go ahead, Mark.
Starts with the mom.
And another thing you had kind of brought up before, a lot of moms are not even sure that their workplace has policies in place. It's called the Pump Act. Your job has a policy in place, and it's a state law that your job should have a lactation room or someplace where you can go and express and feed your and do that as a breastfeeding mom. That's state law. But if you don't know that law exists, then how do you know about it? So what we want to make sure people know that not only it's state law, but there are public places where people can breastfeed. So one of the things that we're working with in our community, as I mentioned, you know, we work with several churches in North and South Omaha. We work with the Omaha Housing Authority Towers, and we work with several community-based organizations so they can become breastfeeding friendly. So they have lactation rooms. They have places where a mom can go to breastfeed and not go to a bathroom. Nobody wants to be in a bathroom and breastfeed. You want a nice room where it's comfortable and you feel safe and secure. So we want to let people know that there are places that are available for that, and you should really look for them and ask about that as you go about your life. Hey, where's the lactation room? If I want to express, where can I go? And they should be a place where they should be able to go. So we want to make sure people are aware that you have rights under the law as far as being a breastfeeding mom.
So my question to you is, Mark, then, say I come in and I just had a baby, but I'm at a facility that don't have that. Can I come to you and ask you, like, where's the nearest place? Or can I come to you for some kind of legal advice in terms of getting that place to have a lactation room? You know what I'm saying? What if I'm at a place that doesn't offer that?
Well, what we would do is, like, you had kind of mentioned earlier, like IB Black Girl, Milkwork. These are the places that automatically know them, but there's also it's state law where they should have some place where you should be able to come in, like the airport or the mall or a workplace, and you know, the bigger places, they should have rooms designed for that. But if you don't see that, then we are definitely at some place you can contact us, and then we can look into that as well, because we want, the more places that are breastfeeding friendly, the better it is for our community. And we want to normalize breastfeeding.
Yes, I was just say we want to remove any kind of stigmas that might be going along with that. And
Exactly.
that's a societal thing, because there's still, not just in our community, but just even in the white community, there's still stigmas about breastfeeding in public and blah blah blah.
I remember it was a big thing.
We got to make it natural. It's a natural thing.
Correct.
It was in the news, all of those things. I remember that. I'm going back to what you said earlier. It kind of stuck with me about this cradle to early life, the prevention that right now, I'm going back to my statistics, right? Because Black women are dying just from from giving birth at a much higher rate than our, what do you call, non-Hispanic Black women. You're talking about 50 deaths per 100,000. White women is about 14. That's a big disparity. So they're dramatically dying at a much higher rate. And the infant health shows that the same is a two-track reality. So the child is also, I think, for every 1,000 live births, 10, we're losing almost 11 Black children are dying. And then in white mothers, it's about 5. I don't understand. Has there been anything, I don't know if you work with that, Mark, or anything like that, but what is the prevention, if there is a prevention, from our mothers and our children dying right at the point of giving life?
Well, I think one of the things that Tisa talked about earlier was education and awareness, and knowing that there are resources and people right there for you who can help you through the process. And then having that knowledge that there's somebody that you feel comfortable talking to, that is culturally aware of your place where you are and what your needs are, then it makes it a lot easier for you to go get the help that you need. Because if you don't know that their help exists, then how would you know who to ask? And if you don't know who to ask, then you're just going to be out there struggling and not being able to acknowledge the resources that are available to you, which was one of the things that we did find, is that a lot of people do not know, a lot of ladies and men do not know there are resources in place to help you.
Yeah. So does Reach have resources for the 3 areas that you guys are specifically on the website?
As a matter of fact, we do. We have a community resource guide that talks about those 3 areas, but we also talk about mental health initiatives. We talk about food insecurity. We talk about just anything that would impact the family or resources where you would need to go. So I'll make sure I send that to you. We got, we're fancy now. We got a QR code for it as well. But we also have guides that we give out in English and in Spanish. So people have that resource guide. So if they have a question and they want to know who to talk to, they can talk to that person.
Absolutely. So what I'm going to propose to you, because Pink Lotus also has resources. So again, collaboration, making sure people know where to go for resources. So I'm going to guide people back to our website. And what I'm going to do, Mark, is add you to one of our community partners Reach program, because you're very much in line with Pink Lotus's mission to provide holistic services to people with cancer, but to our community. We're backdooring the cancer community, but then it's their families, then it's our sisters and our mothers and our brothers, right? And so it's the entire community. Holistic living is the only approach I know for preventative measures in terms of we got to start being proactive with our health, right?
Definitely.
And so that leads us into our nutrition piece, right? So when we talk about mothers and we talk about community, it starts at birth. It starts with the mothers first, the giving them we got to teach people, and not just mothers, we got to teach brothers, sisters, everybody how to eat better, right? The nutritional piece is the main thing to reduce our obesity in our communities, right? It's a big problem. Obesity is a big problem. And all of those health disparities are usually connected to obesity and other things that if we just kind of learn how to eat better, and eating better is a big thing for our community culturally. Learn how to eat better. It starts at the table. So when we talk about prevention, we always have a health piece, and we talk about prevention and nutrition. So nutrition is one of the next things that you guys cover in your thing, right?
Correct.
Nutrition is a big part of Pink Lotus's programming in terms of teaching people to eat right and be preventative in terms of your thinking and what you're eating, right? So nutrition. So we often find farmers markets, right? You guys find farmers markets in the summertime. Where can we first find healthy foods?
And that was one of the issues, because a lot of people, we have food deserts in our community.
Absolutely.
So, there's now that they close Chubb's down, off
I
of
forgot about
16th
that.
Street.
Are they not opening it again?
They're going to open back up, but they're going to open up more like a Mega Saver. So it's not going to be the full line grocery store that it used to be for years. I'm going to be like not politically correct.
Mega Saver meaning the gas station.
But that's
gas station.
I used to go to Chubb to go get my feather bones.
That ain't even an equal Mega Saver.
No,
and that's bringing in liquor, smoke products, shit we don't need. Excuse me.
Exactly. And then the other place, inside North Omaha, I mean, is Phil's on 30th and Ames.
Right.
Outside of that, then you have to go like the Walmart on the Baker's on 72nd. You have to go to the Walmart up on 58 and Ames. Then there's Baker's way down in Florence, and there's another.
Did they close that though? They were talking about closing that.
They closed.
Oh, the Baker's is still there.
The Baker's is
the
still
High
there.
V. They were talking about closing.
But the issue is, if you don't have a car,
you can't even get there.
How are you going to get there? That means you got to, in the old days it'd be a jitney, but now you have to do an Uber or a Lyft or something like that, and that can be expensive.
And Mark, I want to bring up a point you mentioned, because if you flash back to our childhood, there was a Safeway right on 24th and Lake.
Yeah.
There was another Safeway, I think, right there on 30th and Parker.
Yep.
For a long time.
Stinky was right there on 20th.
Yeah. There was places.
They were close.
Walking distance. You could walk there and get the fruits and vegetables that you need. But we don't have those places in our community anymore. So we can talk about you need to eat healthier, but if there's no place for me to go get the food and I have to go get a ride or spend $20 in order to get there, that's $20 that I could have been using to buy more fruits and vegetables. There's a program that a lot of people don't know for moms who are or for families that are on SNAP and WIC, that it's called a double up food bucks program, where you can double the amount of fruits and vegetables that you get by using the double up food bucks program. But if there's no place in your community where you can use them,
or accept that, because that's a program.
Or if you don't even know about the program, how would you be able to know to get someplace to get the fruits and vegetables that we really, really need to improve our long-term health?
Now, is that a double up program for people who are on WIC or on SNAP or something that?
It's specifically for moms or families who are on WIC and not on SNAP.
Okay. Yeah.
But
we got to get that information out, right?
Exactly.
So do you have information? I want to make sure that I have all the resources. So when I put you on my website, what it does, Mark, is it takes you to your website. So if you guys have that, I'll put you under our mind, body, and spirit. You're probably going to be under our body section for like things to go on your body, but as a resource. Yeah. If you can have those things, and I'll add you. That's we just connect the resources, right? Making sure they know. I didn't know that, so I'm not a WIC mom, but.
No,
you need to get that information out.
So we talk about fruits and vegetables, but if you can't go to a store where they have them, so how can you get that?
And let's get to the importance of, Mark, of why this is so important to have a nutritious diet. I'm going to go back to my statistics. Now, so in 2024, they're saying 13.7% of U.S. households experience food insecurity. But get this. But among the low-income households, it's under 130% of the poverty line. Food insecurity hit 45% of Black households. That's like half of the Black population is experiencing food
insecurities. Correct. And one of the things that we discovered from our survey is a lot of people are worried that they're not going to have enough food to make it to the end of the month. And especially with the food prices that the way they are now, that's even a bigger issue. So it's one thing to talk about fruits and vegetables and eating better, but then you have to be able to afford it.
Yeah.
And you have to be able to have it in your community where you can get it. So those are issues that we're talking about.
So this is what's so important about that. Now we've talked about the problem that there's a lot of food insecurity, and then there's access to the food that's outside of your community. But check this out. So the things that we are consuming, these are statistics. This is from the World Health Organization. They're saying that about 18% higher, this is cancer, colorectal cancer risk from processed meat. So when you're eating processed meat, you have an 18% higher risk of getting colorectal cancer. Also, fiber. Large studies often show, these are stats, about 10% lower colorectal cancer risk for every 10 grams a day of fiber. So if you're putting fiber into your body, you're going to lower your cancer risk. Fiber is like fruits, vegetables, things like that. If you're eating processed food, processed meat all the time, you have an 18% chance of getting cancer. We got to look at these statistics because that is how we got to look at this prevention math.
Correct.
Well, and I think we got to get that information out. People kind of know, but I'm more grassroots. I want to make sure that people have access to the foods, but we need to do more in terms of helping to prepare the foods. A lot of times you do get into our homes, and younger people especially, they don't know how to throw no vegetable stews together. I know how to throw some vegetables in a pot, boil that stuff, season it up, put a little whatever, and make vegetable stew. They don't know that kind of stuff. So kind of bring. Right.
That's a great point, because a lot of people, you can talk about eating healthy, but if you don't know how to cook healthy and nobody's ever cooked healthy around you, how would you know how to do those things?
Right. Those vegetables are going to waste in that cupboard and in that house. Really, they might even have them in the house, but if you don't know how to prepare them, if you don't know how to use those vegetables, it's just not used. And so there's a lot of education needs to go on about prepping that food and what makes sense. Don't fry everything. That goes back to learning how to prep vegetables that are healthy for you for your living.
Just that's one of the things you talked about earlier. That's about farmers markets. One of the things we did this past summer is that we held farmers markets in the community. We did a couple at Omaha Housing Authority. We did some at some churches in North Omaha. We did some at some churches in South Omaha, so people can come and get the fruits and vegetables that they need and they want. And then we also talk to them how to prepare them properly, so that way they can eat right and eat better for that short amount of time. But another thing that we're also working on is working with City Sprouts in terms of creating more community gardens. Because if your church or your organization has a community garden, I have some friends, you go in their backyard, man, it's like a farm back there. So they fruits and vegetables, everything, tomatoes, peppers, cucumbers, they have everything. But that's food that they don't have to buy anymore because they have it. So a community gardens is another thing that we're working with the churches about, is beginning to work with and OHA to create community gardens to give our people that access that you were talking about that we're not getting access to right now.
And Mark, there's a lot of community gardens out there again, so let's make sure that we let them know of people, the current ones that are out there, because people do have a lot of community gardens out there. If it's not in your neighborhood, there's one close, I guarantee you.
Yes, there are. There are several, and in our resource guide, we list them. We list the community gardens. We list the farmers markets, and so we want to give people those ideas of where stuff is at, so you know where it is.
Yes. So quickly, we're going to shift because nutrition is important, but can't leave out the physical activity. I think most of us is good on the physical activity piece. But again, when it comes to reach and how you guys are trying to talk about physical activity, what are you talking about? Access to physical activity? You're promoting programs to make you move what?
All of the above.
Okay.
But the first thing is you mentioned it's one thing to talk about going to the park. But can you get to the park? Are there sidewalks? Are there street lights? And then what happens when you get to the park? Is it taken care of? Is that a park that you want to take your family to? Because you say, I want to go to the park. If you can't walk there in 10, 15 minutes, and say you got a family and little kids and you want to go to the park, you're not going to be able to go if you got to cross a busy street. And then if there's not anything there that's family oriented to let your kids run and play, then it's one thing to talk about physical activity. The other thing to have access to facilities and the places where you can do that. And a lot of times we don't have those facilities or that access.
So are you at Reach, are you providing the transportation to the places? Are you working with the parks to make sure that they are accessible to the community? Like how does Reach do that?
You nailed it. What we're doing is we're working with Parks and Recreation to work with them on what does the park look like? What can we do to improve access to the park? One of the things that we saw that people weren't going to the park because a lot of the parks aren't clean. But then, so we talked to the people from Parks and Recreation, and they said, well, one of the problems, we have a staffing problem. So we don't have the staff to clean up all the parks on a regular basis. So one of the things we're working with them is talking to them about is how are some ways where we can work together as a community to keep the parks clean, to keep that access there. So when people,
the neighborhood associations, right?
Exactly. There are natural partners in every community that you need to bring to the table.
Sure. Because they'll take care of parks that they're using. Yeah.
And you need to bring them to the table at the beginning, not after you figured out what you want to do. Bring them to say, hey, this is the problem. This is in your neighborhood. What do you think? How can we work together to increase that access to make the community feel better about itself?
Awesome.
Well, we've got to put the stat on that. And this is important to understand that only right now, and this is 2020, it said 16% of non-Hispanic Black women met both. These are two criteria. That is aerobic activity guidelines and then muscle, strengthening guidelines. 16%. That means almost 85% of our people are not meeting these guidelines. Movement is medicine. And we know that regular exercise is linked to, in many studies, about 10 to 20% lower breast cancer risk if we just exercise. So these kinds of programs that you're talking about, these are life-saving programs. So they're not just, these are nice things to do. These are things that actually make you healthier, wealthier, and have better relationships.
Absolutely.
It's even simple things like knowing that they're creating the North Omaha Trail system.
Knowing that, right? And Tony, we're just talking about that.
Getting on the trails and walking. There's a statistic that say if you get in 3,000 steps a day, your physical activity, your health increases exponentially.
That's it.
That's because you're just walking through. It's not saying doing aerobics. It's not saying riding the bike. It's not doing it's just getting out and walking on a regular basis leads to a better quality of life. That's across the board.
Is that what you do?
That's all
we
I
always
do.
see you on live.
That's all I do is walk. Well, but as I get older, I need to start working on toning and strengthening. But yes, and I'm age appropriate because I used to be a big athlete, right? I was volleyball, tennis, softball. I was out there. But as I've gotten older, I'm more age appropriate. So walking, I gotta walk my dog. My dog is as old as me. She's 14. So we got to keep moving. Keep moving. But the minimum thing you can do is walk. Right, the minimum you can do is walk.
And one of the things that we did was,
so let's get out there.
One of the things that we did with our churches and our and OHA is we understand because a lot of times you don't have access. So we created walking trails maps for the facilities. So the church had you walk around the church 10 times, that's a mile.
Right.
So that way you don't have to worry about getting to the park. Or because we know Omaha's got crazy weather. What was it looking like a week or so ago? But there's a walking trails map that we work with that we put inside churches and inside organizations so you can get that walking in regardless. Whether it's hot, wet, cold, or whatever. Get that walking in, get that stuff in because it's going to lead to a better quality of life for you no matter what the situation is.
And do you guys have those resources on your website as well?
Yes, we do.
I love it. So come to our website, go to their website, and we're going to be making sure you guys get all the resources. So lock it in.
I'm loving the collaboration. This is how we come together as groups. We're not working in silos. We got community working with community partners, working with the community. We understand the statistics. We got that. We got to start moving these numbers up. And the only way we move these numbers up, we got to get to first. You got to get awareness. I got to be aware. Education, collaboration. All these things are so important. So I want to see these numbers go in a different direction. It breaks my heart to find out that our mothers and our babies are dying before their time. And if we can do anything that we can do to prevent those types of things, I love what Reach is doing. Before we let you go, Mark, you got to give us your last words. If you're talking to the community right now, people are leaning in, they're listening, what would you want them to know?
What you gonna tell them, Mark? What you gonna tell them? What you gonna tell them?
What you've been saying the whole time. Eat better, eat healthy, get some physical activity in, and then talk about things like breastfeeding because the thing, a lot of men don't really understand about breastfeeding, but them and their partners are comfortable talking about it. But you got to talk about it. So we begin to start talking about these things, asking these questions, getting more physically active, eating better foods, because it's going to increase our quality of life. And then we can begin to battle some of the health disparities that Grant has talked about earlier, because how do you address those health disparities are exactly the things we're talking about today.
That's right.
Eating right, getting out and being active.
That's it. And really, we're trying to, with health, wealth, and relationships, just really shift mindsets. We really, it's like we hear it and we know, but we're just trying to move the knowledge to the table, to the home, where we try to give out tips, little tidbits that you can do. So in terms of getting your steps, park farther back in the parking lots.
Yeah.
Have your keys ready just in case somebody's ready to jump you. But park farther back. Take the stairs, take the stairs instead of the elevator if you work in a building. Get out and just hit your parks to get that natural sunlight. Walk your dogs if you have them. Don't let them be backyard dogs. Get back.
Yeah.
Walk with your teens. Walk with your grandkids. I'm trying to build a legacy of good health. I want to be able to, our kids be able to say, my grandma, we walked the park. She got us out there, because some of our mothers aren't doing it, but as older people, we know the real importance of, and it's really giving you some quality time with your grandkids. Get them off them devices. Say, we finna walk the park. I'm finna get my step. You finna get your steps in, and then you can have some quality conversations with your kids.
What I would say, growing up, we started this conversation about how we all kind of grew up in the same neighborhood. I used to walk over to Fondale Park. I had access to basketball, baseball, track.
Well, we walked back in our day,
but it was only a block, so I can go right over there.
I walked from 18th Street to Adams Park, which is a long way.
Yeah.
18th Street to, what is Adams Park? 25th and something.
That's more than $6.
Benson, Bedford, off of Bedford.
Yeah, it's off of Bedford.
From Horseman.
Yeah.
Yeah, from Horseman up there. That was a walk. But see, we didn't mind walking. We walked as a neighborhood, because I marched in Salem's Baptist drill team.
Okay.
So we had practice up there. And so we walked. We had practice and walked back. That's how active we were. That's a few miles. You know what I'm saying?
I think what you said was important, is that starting with the children and putting those things into children at a young age, so they grow up eating that way, and they grow up understanding about physical activity.
Go up walking far distances.
And then it's part of who they are. It's part of their DNA, and they're used to doing it, and then they can pass it on to the next generation.
Right.
Love it, Mark. I want to thank you again for taking the time to talk to me and Tisa, because I'm telling you, just seeing your face brings back so many memories. They are great memories, and I love it when we can work together now to actually, because you got grandchildren, I got grandchildren. Like, hey, we don't be intentional. It's about being intentional. You have to be intentional. Yeah, you got to turn that stream of negativity into something positive, and that takes a community effort. So I want to thank you again for being on the show.
Thanks, Mark.
Well, thank you very much. You guys are doing a great job, and I really appreciate you having me on your show.
Yes, thank you. We'll have you back. We'll do some follow-up a little bit later.
That'll work.
All righty.
No problem.
Have a great one.
Peace. All right.
Well, I think he was another good guest.
I was worried. I knew him back in the day, and I just wasn't sure. But you know what? The man has become a stalwart in the community. He's a pillar of health. I like him.
Yeah. We got that background. It's good. And so we're going to continue with our March things. There's a lot of stuff going on in March. So for some of our next upcoming episodes, we're going to work on the colorectal. We're going to talk about colorectal cancer. Like you gave some statistics to that. Definitely leads right back to nutrition. So we want to make sure we recognize that. And nutrition, we're going to focus more on nutrition, because that is really the most important piece to dealing with obesity. Is getting the right nutrition, learning how to eat right. And it's a lot for us. We have to relearn how to eat right. So we're going to make sure we continue to focus on that.
I think it's intentionality. I'll go back to what I said earlier. Be intentional, but to try some different foods. You think, I need more salt, I need more sugar. There's a lot of foods that are just beautiful without doing anything to them.
The seasonings are already there.
Great. And you just have to make that choice. And to get out there, but we want to
make that change.
But we want to hear from our audience. Like, Grant, that all sounds good. Tisa, that all sounds good.
Change.
But we got to know what you're feeling. How can we reach you? We want you to be involved in health, wealth, and relationships.
Absolutely. Drop us a question. Drop us a line. Tell us if we're doing good, bad. Otherwise, we can take it.
All right.
We know we're doing good. And hopefully, if you want to hear some topics, let us know. We are open to talking about whatever you want to hear about.
Absolutely. So again, make sure you subscribe. Health, wealth, and relationships every Thursday, 10 a.m. You want to see all our past episodes? You go to Tisa's website. Where's your website, Tisa?
You can go to the Pink Lotus website, or you can go to my Facebook page, Tisa Harden.
And YouTube.
And on YouTube.
And your YouTube.
And LinkedIn.
And
for Grant.
I got all the shows on LinkedIn. So take a look at them, but we want to hear your comments. We want to understand where you're at so we can work together. So thank you again for tuning into the show.
Thanks. Peace.
All right. Peace.
Imagine waking up with more energy, a peaceful mind, and relationships that grow stronger every day. That is the vision Tisa Harden and Grant McGaw want to help you achieve, and it all starts with simple, practical steps you can take this week. On health, wealth, and relationships, every episode brings you real stories and trusted experts. Tisa and Grant focus on 3 tactical steps each week. Small, doable moves that protect your health, grow your savings, and bring you closer to the people you love. No complicated rules, just real progress. Try a clinic-to-kitchen swap to boost your energy. Start a money buffer habit that quietly builds your financial confidence. Or try a 1-minute exercise that helps you reconnect with your partner. These quick wins are not chores. They are steps toward a better life. People who try just one intentional step report more energy, less money stress, and evenings full of laughter again. Join Tisa and Grant. Start small, live bigger. Tune in every Thursday at 10 a.m. on Facebook, LinkedIn, and YouTube, and subscribe now.